Question number 3. Hey, Dr. Islam, how does alcohol affect your gut? So, I understand people want to drink. I understand alcohol can be a significant social interaction tool for a lot of us, especially, now that we're getting together, now that COVID-19 is dying down in certain areas of the world, we're doing more and more interactions with other people. We're having to do less social isolation as well. But one of the things that we do is we drink alcohol. We know that alcohol just overall increases the amount of inflammation inside your gut, inside your GI tract, and that overall has a negative consequence with your gut. Number 1, it does increase your risk for developing acid reflux. Alcohol is a trigger for acid reflux. It causes that sphincter between the valve and the esophagus to open longer and more often. It causes more and more acid to come up to cause worsening acid reflux. Number 2, so we know that alcohol also causes a lot of gastritis or indigestion or abdominal pain. And that's a very common cause. In fact, we have a term for that called alcohol gastritis. So we can actually see this with the scope, where we can actually see damage inside the stomach from alcohol use. And it's hard to pinpoint how much alcohol you need to cause damage. Everyone's different when it comes to that. That's another thing that can occur as well. Number 3, you obviously know this, but liver issues can occur with alcohol. Now, not everyone who drinks alcohol will develop liver cirrhosis or liver disease, and it's hard to really determine how much alcohol you need because everyone's so individualized. People metabolize it differently. But we do know that alcohol is a direct toxin to your liver. We also know that alcohol in certain individuals can increase your chance of developing liver disease or what's called liver cirrhosis as well. Number 4 is that we know that alcohol can change your gut microbiome, and there's a direct effect on that. It decreases the amount of good guys and increases the amount of pro-inflammatory bacteria inside your gut microbiome as well. And that can make things a lot worse for a lot of our patients. And that change in your gut microbiome over time can really make it more likely for you to have gut diseases, bloating, distension, IBS, small intestinal bacterial overgrowth, things like that. And then lastly, and last but certainly not least, there is a significant risk of developing cancers from alcohol. And there's a lot of cancer that are out there that are related to alcohol. Esophageal cancer or cancer of the esophagus, stomach cancer, liver cancer, colon cancer, pancreatic cancer. These are some of the small cancers just within the GI tract. And there's cancers outside the GI tract that can really be a direct correlation for how much alcohol you drink. And so these are the very common things that can cause issues whenever it comes to your GI tract, when it comes to alcohol. And once again, it's hard to know for each individual how much alcohol you need to drink to cause damage, nor is it hard for us to know exactly which type of alcohol you need to have for it to cause the damage inside your gut. Everyone's so individualized when it comes to that.